Okay, so we are doing the presentation on the Mental Health in Schools Act, and our campaign. So here we go.
The background of Mental Health in Schools Act is that it was founded by Grace F. Napolitano. The Mental Health Caucus was inactive and wanted to pursue changes when she came into office in 2001. She believes that people suffering from mental health issues are more of a danger to themselves than anyone else, and she wanted to try to prevent this. So she started the School Act in 14 El Monte schools in 2001, and then she asked for the bill to come in place in 2013. Students, parents, and she has stated that it has been successful so far.
Okay, so we pulled some statistics off of the Institute of Medicine website in regards to mental health. In February of 2009, 50% of people with a mental health diagnosis first experienced it by the age of 14 years old, and 75% by the age of 24 years old. Suicide is the third leading cause of death of children ages 15 to 24 years old, and has doubled for 14-year-olds. Screen share doesn't come up. And then here is a chart to represent the suicide rates by age and gender. Kids ages 10 to 18 years old. In 2006, we got this chart from National Center for Children in Poverty website. As you can see, males ages 16 to 18 had a higher suicide rate than any other category.
What's missing? There is a lack of data that is shown to the public to prove that the Mental Health in Schools Act has been effective. This act has been made into a bill, but there is no data, even in the bill, to show that this act is needed in the school districts. So if you can find any, please let us know.
We have taken action by creating a petition on change.org in regards to petitioning for more data or any data of effectiveness that Napolitano has stated there is. We posted the petition to each of our Facebooks in order to get more signatures. This is our petition that we have created. It is the Demand More Data from H.R. 628 regarding mental health in schools, and we are demanding this from Congress and Congresswoman Napolitano. On the right-hand side, you can see that you can fill in your information to sign a petition, and it is very easy to do. In this petition, we have a couple statistics, one being that 1 out of 5 students have some sort of mental health issue. Napolitano stated the program has proven to be tremendously successful in helping students overcome mental health issues and improving quality of life for them and their families. But this data is not anywhere where we can find it. And by signing this petition, you're requesting that the data to support the Mental Health in Schools Act, H.R. 628. On the right-hand side, you can see our recent signatures. So please sign the petition.
Results of the petition. This petition was created on July 7th, 2014, and then posted on the group members' personal Facebook pages. And as of this day, there are 23 signatures. Of course, we would like to see that number increase as the campaign continues. Some of the comments that were also posted on our petition are as follows. There is a definite need for education and an open dialogue without the stigma attached to this horrible illness. Another participant stated, I myself suffer from a mental health issue, and I know how hard it can be to cope with mental health without the proper support system and medications. Furthermore, someone else said, I agree, there is definitely a need. Lastly, another participant stated, This is an amazing start, but mental health in general needs to be prioritized and unstereotyped as a whole. It's so biased, and everyone automatically assumes you need to just buck up or that you're completely insane and need to be in a padded room. Too many lives lost to this silent disease.
So from here, we would like to do back-to-school fairs to educate both parents and faculty on this bill and what we are trying to do with our petition. We also want to post signs by back-to-school supplies in stores such as Target and Walmart to increase awareness that there is no data available on this bill, and we want to increase interest and get more signatures on our petition. And we also want to educate mental health facilities and free health clinics with our information so they can provide resources to their clients and give them signs and presentations. Our limitations are that we only did it in the Kansas City, Missouri area. We didn't branch out into other counties or the Kansas City, Kansas area. We are assuming there's a need for this program as there's lack of data. The bill also stood still in 2013, and there's no information as to why it's not moving forward, what happened to it, did funding run out. We just need more information. We can't do adequate research, such as interviews of human subjects, and there's the stigma of mental health. Nobody wants to talk about it and be aware that mental health issues are current in our adolescents.
So due to the lack of data at this time, we are not sure where further research is needed.
The implications of the campaign is to make the community aware of possible mental health programs, although there's a lack of data to prove the program to be successful. That is why we have the petition to gain access to the data to show that this is successful.
Okay, thank you for listening to our presentation. If you guys have any questions, please let us know.